there's a fantastic bit of equipment that we're going to find out about now. Let's find out about the Immersive Suite.
So I'm Helen Ansell. I'm the simulation lecturer for the School of Nursing and Professional Practice here at the University. So currently we're in the Immersive Suite, which is one of 3 across our campuses here at the university. The Immersive Suite is a sensory input that we use for clinical settings. So what I mean by that is it adds audio and visual backings to scenarios that we can use, which can cause distraction for the student, putting them into more of a realistic life setting for their clinical practice. We have different settings that we can use. Currently we're in the operating theatre with a patient that is about to undergo eye surgery. So we set the scene with the student, and the student then works through the scenario with the instructor. The students use the equipment during their simulation blocks, which are embedded into their academic degree. And they start off in the first year with 3 sessions of simulation across the year, and then it just goes up across the 3 years, building on their capacity and challenging them with their clinical skills. So when they come into the simulation weeks, we design a simulation setting around their capabilities and the level that they're at. Okay, so this particular mannequin here is one of our high-fidelity mannequins. She has the ability to blink. We can change her pupil sizes, so we can do neurological assessments on her. We can get the students to take pulses, and the pulse will also come up on the monitor. We can do blood pressure recordings, we can do heart sounds and breath sounds, we can do abdominal sounds. We can use doing basic skills on her, so we can catheterise her, so we can train students to catheterise the mannequins, and we can put other sorts of modules for mannequins on her so that we can do wound care, etc. She can talk, so she'll do generic yes/no answers, she'll make some noises, but also we can actually get students to interact with the mannequins because there's a microphone in the chest, so that I can then speak to the student through the mannequin using a headset and microphone.
That was Helen. This is also Helen, in person. Helen, lecturer in simulation for adult nursing. Tell us about you. What's your background?
So I've been nursing for over 30 years. My background clinical setting is intensive care, which I've worked in for about 12 of those 30 years, and then I was excited to go and work as a clinical educator, which I've done for 18 years. In 2006, I emigrated with my family to New Zealand, and I worked in their health setting, returning to Derby in September last year, and very privileged to get a job here at the university working with Derby students.
Yeah, absolutely. I've heard fantastic things about New Zealand. It's a beautiful country, yet you came back to Derby.
Yes, I did come back.
Fantastic news. Okay, so we've seen a video about the Immersive Suite. In reality, you work with it all of the time. How well does it replicate real life situations?
So the Immersive Suite is an amazing piece of equipment because what it can do is have sensory input into what is essentially a sterile situation when we're just in the clinical skills suites away from a real life setting. So it puts in audio, it puts in visual, which means the students has to work with distraction. So if we were doing a drug round and something distracts the students, they could make a drug error. So it helps them overcome distractions and noise element that they will get in a real life setting.
I've been in a hospital ward. They can be really busy, lots of distractions, so it's fantastic that it's simulating that. What other environments, what other situations can it replicate?
So we can replicate anything. We have a 360-degree camera that goes out into any community setting and just films it, so we can have lots of scenarios going on in those particular real settings with lots of noise and audio going on, so it works really well.
Yeah. Can you put other things on there? I'm thinking like maybe a Batman film?
We could try that later.
Fantastic, let's do that. It's a date. Well, it's not a date, but
okay.
let's keep it appropriate. Okay. So obviously a student comes here, they work with the Immersive Suite. How does that relate to real life when they enter employment?
So what we found with research into simulation is that it will help the student develop skills around problem solving and critically analysing. And we've also seen that any student that undertakes simulation training in their degree will be less likely to make errors during their clinical settings. So it actually makes them more employable.
Wow, that's a big stat. It really is. And how have you worked COVID into the Immersive Suite?
Yeah, so COVID's been very challenging.
Yeah.
What we've managed to do here at the University of Derby, we've been very fortunate to get a virtual platform. So that essentially has a patient as an avatar, and the students can work through that scenario in their own environment, and they're tailor-made to the level that they're at. Other things that we've put into place is virtual practice placements, where we've had students working through some problem solving situations with patients across the weeks, and that has, with feedback we've had, has been amazing.
Fantastic. The Immersive Suite is just one of the wonderful pieces of equipment here, and you work with it every day. How cool is that? Helen, thank you very much.